Good morning. My name's Bettina Hein, and I'm the founder and CEO of Juli. I'm a 2007 Sloan Fellow, and I'm super pleased to be here. I am a serial tech entrepreneur, and this is my third company. I've built two prior $100 million plus companies, and with Juli, I'm hoping to make a real difference in the care of chronic conditions. As you know, Americans have a lot of chronic conditions. Over 50% have a chronic condition, and 50% of those have more than one, and that is generates about 90% of all healthcare costs in the system. Only 10% are acute. What it does is our system doesn't really empower patients to engage with their health data. They're not empowered, and they're really fatigued by all these different types of solutions that are out there that are really not seeing them as a whole person. Medication adherence is low, and there are high costs for payers, as well as low adherence, which is lost revenue for pharma. And we all know about the provider burnout because there is just so much to do to manage patients. Juli solves this problem, and here you can see how we do that. We help patients like Emma get better using Juli. Emma has multiple conditions. She has migraines and depression. She discovers Juli actually through the medication that she's taking through the pharma company. She gets that on the packaging of the new migraine injectable that she has. And when she starts using Juli, she gets insights into her triggers and into her levers. It shows her environmental factors and says, you need to go out more. So she borrows her neighbor's dog. Her doctor modifies her treatment, and she gets better. And we do this in a very simple way with a sophisticated back end. We pull in data from your phones. We pull it from your smartwatches, from wearables, other connected devices, environmental data like air pollution or pollen count. We pull in EHR information like lab results, and we identify patterns and give people recommendations that are not only personalized, but also gamified and are engaging for them. We really enhance medication adherence in all kinds of ways. People can interact with us wherever they go about their day. Within 90 seconds or less, they are done with their interaction with Juli, and we do 90% of the work ourselves by passive sensing. And we're an enterprise scale solution, so we are SOC 2 certified, we're HIPAA attested, and we have this Fire-based integration into EHRs and other patient care provider workflows. We've shown that Juli works. We've conducted 2 randomized controlled trials together with University College London, together with over 500 participants. Both of them reached their primary endpoint against an active control. And for example, in depression, 51% of our users went into remission. We currently cover over 10 conditions, and we constantly add new ones and can do that very easily within weeks and white label our solution. Our secret sauce is that people engage at about 9 times the industry average. People use Juli after 30 days, 30% and over 2.2 times a week. We've reached some really important milestones in the company. We're 4 years old. We've onboarded over 30,000 patients, completed the trials that we spoke about, signed a multi-year 7-figure contract, and are now working on commercial rollout and value-based care. My asks for you today are introductions to your colleagues. I know a lot of ILP members are here where we already have conversations, so we would love introductions to your global and regional brand management, patient support and hub services, late-stage trials, and if you're in a hospital system or a payer, introductions to your chronic condition care programs or value-based primary and specialty care. Please come see our lunch demo. We'd love to demo Julie for you. Thank you very much.